I'm Dr. Narendra, Consultant Endocrinologist at Aster Whitefield Hospital. Today I'll be talking about type 2 diabetes. So if you look at the prevalence of type 2 diabetes, it amounts to about 90 to 95% of all forms of diabetes diagnosed. And if you look at the difference between type 1 and type 2 diabetes, of course type 1 diabetes is completely autoimmune or insulin autoantibodies related problem, whereas in type 2 diabetes is more of lifestyle and overweight or obesity and physical activity related problems. So the common causes of type 2 diabetes is genetic reasons, parents having diabetes, obesity, lack of physical activity, pre-existing hypertension, dyslipidemia, so cholesterol problems, pre-existing cardiac problems. So these are the patients who are at risk of developing type 2 diabetes, and also women who are having the condition known as polycystic ovaries. Even these women are also at risk of getting type 2 diabetes. Now if you look at the prevalence of again type 2 diabetes, almost over 77 million population in India, and as we are speaking, about 8 to 10% of the patients are diagnosed in India with type 2 diabetes, and nearly half of them are undiagnosed. India is labeled as the capital for type 2 diabetes because of the high prevalence in our population. And the patient with type 2 diabetes commonly present with increased thirst, excessive urination, frequent urinary tract infections, weight loss, drowsiness, increased appetite. So these are some of the symptoms, and many a times these patients can also be asymptomatic. That is why nearly many of them go undiagnosed, and sometimes they get picked up during a routine health check or any other member in the family diabetes asking them to check their blood sugar levels. And why type 2 diabetes is important? Because of the high prevalence and also the risk of complications which are associated with type 2 diabetes, mainly the eye complications, also known as diabetic retinopathy, cardiac complications leading to early age cardiac problems or premature death, strokes, and also lower limb problems, and also renal problems leading to kidney failures and also leading to dialysis. And of course the other dreaded complications of type 2 diabetes is lower limb amputations. So it's very important to have a good glycemic control to avoid these complications. And how do we do that? The best way to do that is having a healthy lifestyle and also regular physical activity, at least 20 to 30 minutes daily as much possible, and also taking the prescribed medications as prescribed by the doctor, because having a good glycemic control, you can delay or postpone the onset of complication and have a healthy life. Remember, whatever the complication sets in type 2 diabetes is usually irreversible, and it can be increasing or decreasing your quality of life. It is also very important, because type 2 diabetes is a chronic condition, to have a regular follow-up with the doctor, and also do the HbA1c test or the glycated hemoglobin, which tells us how bad is your diabetes and how well to control it with the use of medication and with the use of diet and lifestyle changes. And again, with the use of continuous glucose monitoring, we could help in reducing the glycemic excursions or the variations, because these also increase the risk of complications in type 2 diabetes. So we at Aster Whitefield Hospital provide not only care for your type 2 diabetes, but very comprehensive care associated with the risk of type 2 diabetes, like the eye care, cardiac care, renal care, and other related problems, having a very good treatment for your diabetes and the related complications. Thank you.